test cassette, workstation, extraction tube, dropper tip, extraction reagent, sterilized swab. The detection steps include: insert sterilized swab through the nostril parallel to the palate. Gently rub and roll the swab. Leave swab in place for several seconds to absorb secretions. Slowly remove swab while rotating it. Insert swab into the posterior pharynx and tonsillar areas. Rub swab over both tonsillar pillars and posterior oropharynx. Slowly remove swab. Avoid touching the tongue, teeth, and gums. Add 10 drops of extraction reagent into the extraction tube. Insert the swab into the extraction tube. Rotate the swab inside the tube and stay for 1 minute. Pinch the extraction tube and remove the swab. Insert the dropper tip into the tube, holding the specimen extraction tube vertically. Transfer 3 drops to the specimen well of the test cassette. Interpret the test result at 15 minutes. Do not read result after 20 minutes. Positive. Control line C and test line T appear on the membrane. Negative. One color line appears in the control region C. No line appears in the test region T. Invalid. Control line fails to appear.